You are watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, drug addiction and recovery. My first guest is the founder and executive director of Life's Journey Center in Palm Springs. People from all over the country go there to address issues of addiction, recovery, and relapse prevention. If you or someone you love is facing any one of these problems, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Rose Tijerina-Swearingen. She is the founder and executive director of the Life's Journey Center, a residential treatment facility that specializes in addiction, recovery, and relapse prevention. Dr. Rose, welcome to the program.
Thank you, Randy. It's good to be here today.
Now, this is a very hot topic, so I'm so glad you're on the show today.
It's good to be here.
It's become mainstream, where now people used to have to go, anticipating this interview, done a lot of research, that people, I guess, had to hide and never admit that they were going into recovery. And now with celebrities and everybody is doing it, because of that, more and more people coming forward?
What has happened is that people are being more and more affected by alcohol and drugs and other compulsive behaviors. And yes, people are coming forward. There are celebrities. There is Mrs. Ford that came forward and has given people an opportunity to come forward without feeling shameful about their illness.
Let's start with your background, because you have an impressive background. I guess you used to run the Betty Ford Center. Is that right?
I used to work at the Betty Ford Center for 10 years as a counselor. And I continued there until 1996, when I went to Mike Netherton and I said, Mike, this is a dream that I have and this is something that I'd like to do. And he said, Rose, go with our blessing. So I did.
You opened your own center.
I opened my own center in Palm Springs, the Life's Journey Center, which is a residential treatment facility for addiction recovery, and we specialize in relapse prevention.
Okay.
What I have done, Randy, throughout the years is I have continued to maintain my focus. And
which is what?
Well, my dream is to help people.
You told me off camera, and I'm sorry to interrupt, but you said to me, while we're over there, you say, I've never thought of this is a business. I mean, I really didn't treat it as a business. It was more helping people.
Yes.
Is that right?
It is true, Randy, and I still continue to feel that way, even though, it is a business. It is a business, sure. It's my baby, but it's 10 years old, okay? It's growing up.
Yeah. Well, it's good that you're on this program, because a lot of people, they've never heard of your center.
I don't do much marketing, Randy, but I am here today. I founded the Life's Journey Center in Palm Springs to focus more on relapse prevention. And
relapse prevention meaning the
relapse
obvious...
prevention meaning that recovery is not about just going to treatment for 30 days and it's over after you leave there.
Okay.
Oftentimes what happens is that the addict goes to treatment and they go through the 30-day program. They go home and they forget. They forget what they learned. They forget to practice the new behaviors they have.
So they go back to their old...
They go back to their old habits, or their old environment, their old friends, and it triggers relapse, and they don't know what to do about it. What I do differently at the Life's Journey Center is that from the very beginning, we begin working with the addict, alcoholic, and or their families clinically. We do not require that the person afflicted with this illness call our center. They may have a loved one that is very concerned about their behavior, their drinking, their using, and they may go ahead and make the call.
Like a spouse or...
A spouse, a loved one. Sure.
Now, this isn't common.
A friend.
It's not common in the industry to accept that. That means the person has to bottom out, I've been told, before they could even get in.
Yes.
Is that right? I mean, is that really...
Randy, that is a very traditional concept, and it's a worn-out belief that the person needs to bottom out.
You don't believe that?
I don't believe that, Randy, because everyone that is out there drinking and using are bottoming out in their own way. Some people bottom out emotionally, some bottom out spiritually, some bottom out financially, Some bottom out, relationship-wise, they are being threatened with a divorce.
Okay.
Or maybe the doctor is saying, you need to go to treatment, you need to stop drinking. But because when the person is...
When they lose it all.
When they're into their addiction, it is difficult for them to accept failure. It is difficult for them to say, you know what, I need help. So this is
It's probably a tough time to make a decision about your life, that I need to go get help. Because you're on drugs.
That's right, and that's why
You're not sober, obviously.
We welcome family, loved ones to call our facility, our intake line, and start the process.
Okay.
Our intake director will help them and guide them as to what it is that they need in order to get their loved one into treatment. What happens at the Life's Journey Center once the call is made, and once we engage the therapeutic process, say, be it with an interventionist or maybe the family brings the patient in, we start with a pre-screening assessment, and we move forward with an intake. We find out what the person needs. We have a medical director that will see every patient that comes into our doors.
How many beds, by the way?
We have 20 beds. We're licensed and certified
Small.
by the state
Is
of
that
California.
Small? Is that?
Well, it is for me, and it's also big for me because I interact with every family member that comes in, with our residents, and with my staff. So it's a good size. It's manageable. I am able
You like
to,
that? You think that's an advantage?
I think it's an advantage, Randy, because not every alcoholic addict has the same needs. Every person is different coming into our doors. Now, I often hear that addiction is the same. Yes, that's very true, but you may get a person that comes from a high-functioning family that may have different needs than someone that grew up in a dysfunctional family with alcoholism and drug addiction in their family. So what we do at the Life's Journey Center is we custom tailor the program to fit every person's needs.
How big of a problem is addiction? I mean, when I think of it, I think of just alcohol abuse. But what are you seeing? What kind of drug addictions or problems are you seeing?
People are drinking to feel better. People are drinking more and more, and people are going to other mood-altering chemicals to numb the pain. And
is that how it starts, by the way? They start drinking more and more alcohol, and then they move on to other things?
It starts with an innocent social drink, and sometimes it goes into abuse. They start drinking a little more, feeling that, hey, they're having fun, it's not so bad. And then once you cross the line into addiction, there is no return into social drinking. The problem is significant because you start experiencing negative consequences as a result of your drinking, using, and/or compulsive behaviors.
What?
You know, Randy, I have had a lot of people that have been in a hospital bed because of suicide attempts. These women, these men were attempting to numb the emotional pain they were feeling, and nothing works at that point. So we at the Life's Journey Center are very successful in treating this type of an individual, because what I have done throughout the years is I have taken my education, my personal experience, my life experience, and my wisdom in helping the person coming into our doors. When I left the Betty Ford Center, I didn't leave to open up and duplicate an international program.
Okay.
I opened up the Life's Journey Center to provide treatment to the person that needed an individualized level of care. The person that it has too much shame to go into a traditional setting program. The person that is suffering from addiction and they need more individualized care. Say the diabetic that has to have insulin every day. The person that also has a heart condition that has now ended up in treatment because they've been drinking too much or medicating themselves too much. The person that has that needs pain management. We do have people that come to our program to resolve their pain management issues because they have received narcotics from pain management doctors.
Okay.
And An example was a young woman, beautiful, in her middle 20s, that came to us, and she was on a morphine pump. You know, we have to work with the person entering our doors to detoxify them from every type of mood-altering substance.
So you have medical doctors that work with you?
We have a medical director. We have psychiatrists that work with us. Our doctors focus on nutrition. They help us with monitoring every aspect of the patient's recovery, not only the detoxification, but if there is any form of medical condition they may have, that is addressed upon entering the Life's Journey Center. And they're also referred to other doctors for the proper medical attention. We have nutritionists, we have yoga instructors, fitness trainers, we have a massage therapist.
Okay.
And we provide...
Sounds like a vacation.
Well...
Because that's what I'm hearing more about these places.
You know, Randy, at the Life's Journey Center, the patients work very hard. Okay. It is hard work to start addressing their chemical dependency, because you have to remember that some of these people are not functioning consciously. They are functioning with their mind altered by mood-altering substances. Now we're asking them to face reality. Now we're asking them to face the issues that have been getting in the way of their life. And this is not easy work.
So you oversee the whole center, is that right?
Yes. I am very interactive at the Life's Journey Center. I train my staff, I work with my staff very closely, and I work with the residents. You know, some places say we offer X number of individual sessions a week. Randy, I will be there for the residents as long as they need me. If I
you don't have a set...
I don't have 2-3 sessions a week. If they need to see me daily, or if they're struggling, if I have a patient that has come into our facility that is suicidal, I'm not going to say to her or to their loved ones, I have 3 sessions a week to give you, or 5 sessions a week. I am going to be very interactive with that person to make sure that they get their clinical issues resolved and that they safely detoxify and integrate into our treatment program.
This must be obviously rewarding for you, but very tough. I mean, you're dealing with probably a lot of stress. I mean, you love it. You like this.
Randy, when I worked at the Betty Ford Center, I had a professional that asked me, how can you be still doing this? You've been here over 5 years. And you know, I found then that I did it because I love it. I have a passion for doing what I do for a living. And you know, when I see people recover, I just had a registered nurse that visited us last Thursday. And I said to her, I said, please come and share with the residents about your experience here at the Life's Journey Center. She did stay with us about 4 months. And she said to me, I am so grateful. I will never forget where my recovery started. This woman was in the hospital, she was suicidal, and her husband never gave up on her. He brought her to us, and we started our work immediately. She did not believe in a higher power. She was emotionally depleted. She was a very intelligent woman that knew exactly how to manipulate her way out of treatment centers. And this is where my program is so different. Because with my experience, with my education, with my knowledge, with my wisdom, I know what they're saying, even when they are not speaking, when they're not saying anything to me. I know what they are saying. And most of them want help. Most of them don't know how to ask for help, Randy. They feel so much shame about not being able to control their life. And what we teach them at the Life's Journey Center is that, you know, you don't really have to control your life. But you can manage your life in recovery and be very successful at it. You can return to your family and set healthy boundaries and move on with your life, achieve your goals, be productive, have your purpose in life. I have to share with you about this other woman that came to treatment, and again, suicidal case that ended up in the hospital, and her mother called and said, you know, I'm sending her out there with a therapist. I cannot be with her because she's very abusive. So she comes to treatment, and right away we knew that she wasn't going to like any of us, even Dr. Rose.
Okay. That's hard to believe. Go ahead.
And I said to her, it's okay. She says, well, I'm not going to be here long. And I said, that's okay. For now, we just want you to be comfortable. We want the doctor to work with you. We want you to be safe. And as we move on and we keep working with her and integrating her into our program, into her third week, she looks at me and she says, you know, Dr. Rose, I don't think I'm going to be ready at the end of the month to leave here. And I said, oh, that's wonderful. I said, then we'll continue working on your recovery, right? She said, yes. I got a call from her the other day, and she was telling me how well she's doing out there in the program.
That is really great.
She told me that she went to an AA meeting. She's a meth addict, and she said the speaker was talking about alcoholism. And she said what was very interesting is that he talked about all the drugs he had done, but he wasn't a drug addict. She said, I learned at the Life's Journey Center that I can never drink or use again. And I thought, wow.
That's great.
This is really powerful. This is something that you need to embrace so that you don't set yourself up for relapse.
We're going to take a quick break. We come back. More about relapse, what you're able to do to keep people, prevent people from having to go back and back and back in and out of rehab their whole life, okay? We'll be right back. You're watching the Wellness Hour, leader in medical news information. This is very good. Today we're talking, especially for those of you that have a loved one that is drinking too much, they're using, they have some kind of a drug addiction. This could be the most important information that you're going to hear. We're here with the founder and executive director of Life's Journey Center in Palm Springs. People from all over the country are visiting her center, but also people right here in the Coachella Valley. So we'll be right back. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. With us, very important show today. Brand new guest. We have Dr. Rose on the program today. She is the founder and executive director of Life's Journey Center. They deal with relapse prevention, addiction, and I'm leaving something out.
Recovery.
And recovery. I'm sorry, very important part. Relapse prevention, a big part of what your focus is.
We specialize in relapse prevention, and how we do that is as soon as the patient comes into our facility, we start working with them on not only recognizing that they have an addiction, that it is a family illness, but also that there are issues, very stressful issues that they may be confronted with that may trigger relapse for them. And we start working on those issues immediately as soon as they walk into our facility, which is very different than what most traditional programs do.
Sounds logically that this is what you have to do.
Yes.
I mean,
but it's a lot of hard work, Randy, because as you know, this has to be tailored to the patient's needs. You know, if we have a woman that comes into treatment that's having problems at home with her husband, he doesn't want to quit drinking, and she has to because of medical problems.
Okay.
We're going to have to address those issues, and that means that we have to work with the husband also to help him understand her need to be sober and her need to have a sober environment at home.
So you mix men and women, which is very unconventional, I've been told.
Very true. Very unconventional, because most traditional treatment settings will separate men and women. My philosophy at the Life's Journey Center is to have men and women work together as a family, as people that come to get better. And men need to respect women. Men need to learn how to communicate with women, like women need to learn how to set healthy boundaries with men. And the reason it's different for me is because I am very interactive with men and women, with my staff. And we are very attentive to what happens in our program. It's not about separating men and women. We may have lesbians that come into treatment, gay men that come into treatment, and it wouldn't do us any good to separate the gender.
Okay.
It is more effective to work with them and help them achieve success in recovery than separating them, and then when they return home they have the same issues to deal with.
You say that you deal with co-occurring addictions. What does that mean?
We treat addictions as a whole and co-occurring disorders, which means that we get people that are bipolar, people that are maybe schizoaffective, have post-traumatic stress, people that may have drug-induced psychosis. We don't know, Randy, until they come in and we start working with them and having our medical director, our psychiatrist, involved in the process.
Okay.
Our clinical staff will work with the resident, and once we detoxify the resident, then we start addressing all addictions, including gambling, compulsive spending, sex addiction. And the reason we do that is because people out there are medicating with drugs, with escaping from reality, with gambling, or other forms of behaviors that are very compulsive in nature. And we start addressing all of those issues. We start giving them assignments, working with them, and our philosophy is to have the resident start emotionally and spiritually healing.
Okay.
This is something that they don't have time to do when they're under the influence of mood-altering substances. We take the addict beyond just recognizing that they can never drink again. I have heard so many people say to me, well, I went to treatment and I know I can never drink again. That's just the beginning, Randy. It's about implementing new behaviors in their lives, dealing with stressors, challenging themselves to engage in purposeful events in their lives and manage their life effectively instead of reaching out to a bottle or a bottle of pills.
And you're getting results. I mean, a lot of success stories.
I have a lot of success stories, Randy. Yes, I do.
Good. Now, we're completely out of time, but a lot of physicians watch this program, health practitioners. What do you want them to know about life's journey?
I want them to know that we are a safe environment, we're compassionate, we welcome any intake at any time, and we will give them the very best comprehensive treatment possible, and they will be referred back to the referent once they have completed our treatment.
And you're equipped to handle just about anything. Is that right? I mean, in the world of drug addiction, relapse prevention, etc.
I specialize in drug addiction and recovery, Randy.
Okay.
That is my specialty, yes, and we can handle just about anything.
What do you say to somebody watching this? Because my prediction or my guess with this show airing is that it'll be the loved one that sees this and realizes they have to send their loved one in. Mm-hmm. What do you say to them? Give them some tips on how to get them to see you. Or maybe they just need to call you and you'll tell them what to do. Tell me.
Sometimes the hardest thing to do is to make a decision to send a loved one to treatment. That is difficult because as a family member, you want to believe that this is going to go away, that this is going to get better, and it never does. Once the person has crossed the line into addiction, they would definitely benefit from treatment. I invite you to call our intake line and to get some advice on what to do next.
Okay, good. Now give some advice to the person that's watching this, that's the addict.
Okay.
And I don't think we've talked enough about what could go wrong if they do nothing. Okay. What could happen, where they're headed. Okay. I mean, you know the stories.
Yes.
So talk to them.
You know, for the person that's watching that is in so much emotional pain, that has to drink to feel better, that has to take prescription drugs to feel better, that has to smoke pot, use heroin, escape by gambling. I invite you to look at your life, to look at the fact that it is not working. You are going to be drinking more, using more, and wanting to spend more, gamble more to numb the pain. And it's not going to work. And what happens when you don't ask for help or you don't allow your loved ones to help you, you will eventually self-destruct. And what that means is that you will start facing negative consequences as a result of your drug use. Open the newspaper. There's an accident.
People are going to prison.
People are going to prison.
Their families.
People are self-destructing in so many ways, and that is because their mind is altered with mood-altering chemicals. They are not making sense with what they're doing out there. And if we look the other way, these are our loved ones that are getting in trouble.
Somebody that has this problem, to call you. Because obviously they're afraid, or they would call you. Is it, I mean, they could be private about it? Just ask a few questions?
All our calls are confidential, Randy,
Okay.
and anybody calling our intake line will be respected with confidentiality and will also be given the appropriate direction to help their loved ones. You know, we get people from 18 years of age to 80 years of age, and we treat them with respect, and we teach them how to respect themselves, how to love themselves, and how to engage in recovery. And this is where the family comes in. This is where the family is needed.
Okay. And don't wait until you're bottomed out. Is that right?
Don't wait until you bottom out, because if you are noticing that someone in your family is in trouble, they have in some way already bottomed out,
Okay,
emotionally and spiritually.
I want to thank you for coming on the show. Very, very interesting. We'll have to do a future show at your facility. Take a look around.
Thank you, Randy. You
As long as
probably
you
don't want to come to the facility because they'll
think I'm in
suspect that
treatment.
you're that
That's right.
you're one of our residents.
I'll go into some kind of a back. I'll have to say, I swear, I was going there just to do a news piece on it. But so thanks again for coming on the program.
Thank you, Randy.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this program again online, visit our website. We're going to feature it on the website, brand new look. You could also download this, make a loved one listen to it on iTunes. For now, I wish you good health.